to say that please refer to our earlier video regarding cancer so that you can have a proper understanding of the basic of anti-neoplastic mechanism. So traditionally chemotherapeutic agent for cancer are cytotoxic. That is very important, are cytotoxic. Okay, and by means of, that means the cytotoxic means it interferes the mitosis, and chemotherapy may be given with a curative intent to cure, or it may aim to give to prolong the life, or the palliative therapy. That means decreasing the adverse event of cancer. So we have anti-neoplastic agents that we doctors prefer to give, and I'll be giving you the entire idea which cancer doctor give what type of medicine. So first anti-neoplastic agent, first coming to the synthetic alkylating agents. The first is alkylating agents. Okay, and as you have this name suggests, they are contributing the mechanism of alkylation to the DNA. They attack especially N7 of guanine, okay, and they they produce a cross-link structure between the two adjacent pair of guanine, and they inhibit the DNA replication process. And these alkylating agents are various types. The first is nitrogen mustard. If you see that the mechanism, the chlorine is a good leaving group and the nitrogen contain the lone pair, so they form a very exclusive intermediate known as aziridinium ion. It is known as aziridinium ion, okay, and which is a reactive intermediate to attack on N7 of guanine, and they causes cross-linking structure. They are not intercalators. Intercalators are they fit between the DNA, okay, and disrupt the hydrogen bonding. It is a cross-linking process. Okay, so now if you replace R is equal to CH3, then you have the first drug known as meclorethamine. Meclorethamine is the first nitrogen mustard synthetic alkylating agents. If you replace with phenyl with CH2 COH, okay, then you can get the next alkylating agents known as melphalan, okay, and then if you change the R into an heterocyclic ring with phosphorus having nitrogen and oxygen in the 6th member, this is known as 132 oxazaphosphenan, okay. This gives you the drug known as cyclophosphamide. You have a lot of other derivative also, ifosfamide, okay. Then you can find out their structure. The side effect of cyclophosphamide or in general alkylating agents are quite common. They causes severe nausea and vomiting. That's why we give antiemetic cisapride that I will be discussing in my GIT disorders. Then bone marrow suppression, alopecia, the loss of hair. Then particularly cyclophosphamide, they produce a significant side effect known as bladder toxicity. Their bladder toxicity, remember in NIPER they have asked one question, which of the anti-cancer is having highest nephrotoxicity? So answer is not cyclophosphamide. Answer is cisplatin. It causes nephrotoxicity, but in cyclophosphamide they are causing the bladder toxicity because accumulation of acrolein. That's why to reduce the toxicity we provide mesna, to reduce it is because acrolein can cause hemorrhagic cystitis, hemorrhagic CYSTITIS cystitis, okay, and it also causes neutropenia. That's why the person can prone to infection, the immunosuppression activity, the infertility, cancer, and teratogen. So this is a very important side effect. Now come to the next drug known as nitrosourea. Nitrosourea they are almost like an alkylating agents, but in a different structure. When R1 and R2 become both CH2 CH2Cl, okay, then the structure will become carmostene. Okay, carmostene. Then if it is one is CH2 CH2Cl, okay, and the second one is your cyclohexane, then that is known as lomustine. Okay, lomustine. And if R1 is CH3 and R2 is a sugar means you can have a structure of this CH2OH, H, then on top of there is a OH, this is down, there is OH, then top there is OH, and then you have OH at the top. Over here there is no, this is the structure of streptozotocin. Okay, so streptozotocin is a nitrosourea derivative which can causes diabetes because it can destroy the beta cells. Okay, that's why these drugs are having high side effect, and that's why they're not that much preferred nowadays to give to reduce the cancer. Then you have a DNA methylators which is having a common structure R1, AR, R2, which I have written. AR means this can be phenyl or it can be imidazole. If it is the first one, the phenyl group, that is it's called procarbazine. In procarbazine, the R1 is nothing but your structure of CH3NH2 NHCH2, CH3NH2NH dash CH3, one nitrogen, NH2 CH2, CH2. This is just R1 for procarbazine, and R2 is simple CONH isopropyl amide. Okay, so this is your procarbazine. They are DNA methylators. They introduce a methyl group to the DNA and block their replication process. The second is dacarbazine, which I have mentioned over here, imidazole derivative, where R2 is simply amide, and R1 is they're having triazine, N double bond N, then isopropyl group. So this is the structure of dacarbazine in R1 group, right? And if you see this particular drug, this is a prodrug, okay, known as temozolomide. This is also coming to the DNA methylators, but this is prodrug. This convert into the active metabolites, which is nothing but it open up this structure. Okay, then they have simply this structure also gets open. What is that? Active metabolites. Yeah, this structure also gets open, and this is H, and you have this is not cleaved. This particular structure, this particular bond is cleaved, and you have N CH3, and COH comes out as a carbon dioxide. Okay, decarboxylation, and it is becoming your active of temozolomide. Okay, now after that you have the next drug. You see aziridine, that is called aziridines. You have thiotepa and mitomycin. So not much you have been asked. You can go to the internet to see their structure. Then you have platinum derivative, that is cisplatin, okay, carboplatin, oxaliplatin. They have a side effect of nephrotoxicity and neurotoxicity, ototoxicity, and also hemolytic anemia. Their nephrotoxicity or their side effect can be counteracted by amifostine. This is another combination they give, amifostine, okay, to reduce platinum toxicity. Now the next after alkylating agents, very popular, is anti-metabolites. Now when you are talking about anti-metabolites, remember one fact: they interfere DNA synthesis process, so act on S phase.